Hello everyone, this is Sirisha Bhagavatula. So, I hope you all are doing good. There's a special reason behind coming live today. So, I hope you can hear me well. Please do let me know in the comment section if you can't hear me properly. So, like I said, there's a special reason behind me coming live today. From 1st to 7th September, it is celebrated as the National Nutrition Week, like I informed you yesterday, and you all must be knowing it as well. So, today I'm really happy to interact with you all and understand the importance of nutrition, health, and well being for a healthy skin and hair. But more than interacting with you as audience, we have a special guest here today, who can lead us to understand better how nutrition impacts the healthy skin and hair. So here we have Dr. T.N. Rekha Singh ji, a renowned dermatologist at AV Skin and Hair Clinic in Telangana. So she'll be joining our live session super soon. Please stay tuned. I hope Dr. Rekha Singh ji is here with us in the live session. Let me invite her to the live session. Kindly stay tuned. Namaste, ma'am.
Namaste. Hi, good evening, Sirisha. Nice to see you on this platform. Feels so good to see you here.
Thank you so much, ma'am. Same here. So, how are you doing?
Yeah, I'm fine. Thank you so much. I have been following you. I'm a big fan of Indian Idol. I have followed you all throughout. I've seen your journey. So nice to see you on this. Yeah.
Thank you so much. Same here. So, I've told the audience that we are here for a special reason today to understand how nutrition helps healthy skin and hair. So, I would start this healthy conversation. Ma'am, we are privileged to have you here with us today. So, before starting, I would like to ask you what, according to you, is the right nutrition for healthy skin and hair?
Yeah. So first of all, this evening now we are celebrating the Nutrition Week from September 1st to 7th, which was started way back in 1975. Now, skin is the largest organ of the body. It is true. It is a true reflection of what is going on inside. It can tell us whether you are healthy from inside or not. For example, your digestive system, your hormones, your immune system, anything which goes wrong among all these things reflects on your skin. For example, your acne on the skin can tell you about hormonal imbalance going on. Then your skin dry, fine lines can tell us that you're dehydrated. There are certain lifestyle habits which can also show up on your skin. Like if you're smoking, then you can have the discoloration of the lips, the dullness of the. There are so many things that skin can speak up. So most often we dermatologists as the first one to identify what is going wrong inside and then investigate, ask through the blood tests, and if needed, we put them on supplements, refer them to the other specialty doctors. So skin speaks a lot, definitely. Yeah.
Okay, thank you, ma'am, for this insight. So, I would also like you to ask, can you help us with the nutrients which are a must to be included in a diet for healthy skin and hair?
Yeah. So this is one of the most common questions that I, as a dermatologist, get to hear from my patients. So now we all have to understand that there is no specific diet only for skin and hair. All of us need a well balanced diet, including proteins, carbohydrates, good fats, vitamins, minerals, etc. But for skin specifically, I usually tell them eat the rainbow. That means all the yellow, orange fruits, vegetables, vitamins which are A, C, E, and there are certain essential fatty acids, omega-3 fatty acids, which fight through the free radicals, fight through the waste products that are formed. We all know that skin is an organ which also eliminates the waste products from your body. So it is like a disinfectant. So you have to provide the right nutrition to the skin. So these omega-3 fatty acids, vitamins A, C, and essential minerals like iron, selenium, all the foods which are rich in these substances can help us to have a healthy skin as well as healthy hair. Now, hair is also a part of skin. We call it as an appendage in medical terms. So hair is a part of the skin. So to have healthy hair, all of us have to eat right. So it's made up of a protein called keratin. So it needs high protein diet. A 60 kg person, a male, or a 55 kg old aged women, we at least need at least 50 to 60 grams of protein per day. But are we taking that? No, most of us do not take that much of protein. And then food rich in iron, selenium, these are like minerals which will improve the hair cycle, which will prolong the life cycle of the hair, and it will improve the circulation in the skin. It will provide that dead skin cell turnover. It helps in new skin rejuvenation. All these are very important for both skin and hair. Anything which can go, if there is dietary deficiency, it automatically reflects on your skin. And drinking plenty of water, 6 to 8 glasses of water, having good sleep apart from diet is also equally important to maintain your skin.
Okay, thank you, ma'am. Since you already mentioned nutrition deficiency, so I would like to know what are the signs and symptoms of nutritional deficiency?
Yeah, so now each vitamin is unique, each mineral is unique. For example, if you take vitamin A, whether you are taking excess vitamin A or less vitamin A, the skin shows dryness. You can have chapping of the skin, chapping of the lips, dry hair, wrinkled skin, then sometimes peeling of palms and soles, all these things. Vitamin B12 again shows the B12 deficiency, which is usually found in animal sourced foods. You may see pigmentation, and then hair thinning. Thinning also happens, dryness, etc. And it shows us dark circles around the eyes, sometimes pigmentation around the lips. And you also see pigmentation on the knuckle areas, which usually prompts us as dermatologists to go and check for vitamin B12. Folic acid, it is important for every energy making step in the body. You feel fatigue if you are deficient in folic acid or B12. So you don't feel like working, you feel lethargic, and the skin also gets tightened up. And similarly, vitamin D. Vitamin D is more and more linked to many kinds of metabolism in the body. It is a major factor in maintaining the immunity of the skin and the hair. So vitamin D deficiency, thanks to this COVID pandemic, all of us have stopped going outside. We are not exposed to sun. All of us are just glued to our gadgets, sitting at home. Even we doctors, we were doing online consultation. So vitamin D deficiency is linked to lifestyle problems apart from skin problems like insulin resistance, which can cause pigmentation in the neck area, around the eyes, and you may have pigmentation here around the temples and forehead. Likewise, iron deficiency, it changes the color of the hair. It causes hair thinning. It can cause profound post-COVID hair loss is the commonest thing that we have come across. So zinc deficiency again causes impaired wound healing. You're not allowing the skin to heal properly. And vitamin C again. Now we have two healing substances or supporting substances called collagen and elastin in our skin. So these collagen and elastin repair doesn't happen if you are deficient in vitamin C. People are prone to easy bruising if you are deficient in vitamin C. So these are a host of vitamins and minerals which should be taken care of. You should be prompt in understanding. If you come across any of these changes, you have to meet your dermatologist who can help you out in every possible way.
Yeah, so most of the signs that you have mentioned, even I have, like you can see the acne on my face. So the followers who are here might be wondering why I'm here today suddenly talking about skin. So the reason behind me being here today is even I wanted to know like how it really affects my skin and hair. Of late, I have, especially after COVID, even I got affected from COVID twice. So after that, I've seen a lot of changes in my body, and my hair fall is it increased to such an extent that I'm really worried about it. So even I wanted to know, and I thought my followers, people who are following me, would also get benefited from this information. So I hope you all are understanding how important it is to be careful about nutrition intake for better skin and health. So I would like to move on to the next question. So, what according to you can be done to correct the nutritional deficiency?
Yeah. So first of all, if you come across certain changes like dullness of the skin, dryness of the skin, or you see that the skin is lacking that luster, dehydration, or if you see that you have prolonged hair shedding, for example, you're losing 100 to 150 strands in a 24-hour span is normal. So if somebody sees losing more than that and you feel your ponytail size has come down, your braid size has come down, when you take your photographs, you see that the volume of the hair has come down, then it is time to go see your dermatologist. Dermatologist may assess your skin and hair because they are the experts in that, and they may recommend the necessary investigations. So among investigations, we usually check for thyroid hormone, which is the most common thing that can affect the skin and the hair. And then the nutritional deficiency, which is the most, which is the topic of the day. Serum ferritin, which is a stored iron. Normally hemoglobin may be normal, but that normal hemoglobin is good enough for you to carry on with your daily routine. But serum ferritin is like stored iron in your body, which is greatly impacted by COVID especially. So this ferritin stores are utilized by the hair. Now hair is like an accessory organ to your body. So only when you have surplus iron, it reaches your hair. Otherwise the body tries to adjust it with the other organs. So ferritin should be adequately high. So your doctor may ask you for serum ferritin levels, B12 levels. B12 is largely present in animal sourced foods. So most of us are vegetarians, vegans. Though we call ourselves as non-vegetarians, we are not the ones who eat 3 meals a day with non-vegetarian diet. So sometimes we are as good as vegetarians. So B12 deficiencies, vitamin D, zinc, vitamin C, all these things can do impact. So the doctors may ask you for blood tests, and whatever deficiencies you have, they may replenish it in the form of medications like tablets or capsules for a stipulated amount of time. Apart from that, this is only to fulfill the deficiencies. But later on for maintenance, you definitely need good diet. So regarding diet, once again to repeat, iron source diet, you can have dates, prunes, mulberries, lentils, spinach, all these are rich in iron. B12, you have to again look out for animal source food. You can have lean meat and eggs, yogurt, milk, paneer, all these, and mushrooms. All these are rich in B12. And then zinc and selenium, you have cauliflower, cabbage, and then broccoli. All these are rich in these minerals. And of course, nothing can beat good sleep. Nothing can beat your physical activity. All these put together will definitely help you to cope up with the hair loss. And just for you, Sirisha, since you are worried about post-COVID hair loss, don't worry. Now, COVID has, though you have mild symptoms, it has great impact on your overall system, overall circulatory system or digestive or hormonal system. So once you come out of the body needs some time to come out of it. Sometimes we have seen that it takes 6 months or sometimes it may take 8 months for you to recover from this hair loss. But whatever hair loss you have, you will get all the hair back, provided you're taking the right nutrition, and probably you'll have to go for supplements too in with advice of your dermatologist. Yeah. And we
Thank you so
also
much.
give some solutions also. Yeah, yeah, yeah.
Thanks a lot, ma'am. So, before we move on to the next question, I would like to ask people who have joined today to, post their questions in the comment section if they do have anything. Meanwhile, we'll continue with the other questions. So, which vitamins are considered the most important for skin and hair? And also, what is the importance of omega-3 fatty acids in skin and hair?
Yeah. So as I mentioned earlier, the most important vitamin for hair is vitamin B12, vitamin A, vitamin C. And apart from that, as I mentioned, omega-3 fatty acids, which include this ADA, DHA, etc., which usually are present in this flaxseed, chia seeds. Now, most of us are aware of the advantages of all these things. And of course, zinc and selenium. And regarding the importance of these omega-3 fatty acids, they are very, very essential because they strengthen the hair. Basically, they strengthen the hair. They prevent flakiness of the scalp. That way, the hygiene of the scalp is maintained. They do not allow the essential oils to come down, and they provide a coating to the hair so that the hair is not withered due to external factors. And the other important thing is they are immunomodulatory. That means they will improve the immune system of the scalp, that is the skin and the hair. So, and they also fight with the external factors. They also fight with the free radicals. Free radicals are something like, waste products which are formed because of the various metabolic processes happening in the skin. So they fight with the free radicals and protect the skin from all the negative things that are going on.
Okay, thank you. That was very informative. Then I think let's move on to the questionnaire that we asked. There are few people who are asking a few questions.
Sure, we should
So,
take.
singer Tanuja is asking, can you please suggest the food and treatment for hair thinning in female?
Hair thinning in female. So hair thinning in female, it is because of major reasons. Nutritional deficiency is the most common cause. So we lose iron every month during our menstrual cycles, and Indian women and girls are in general, they are deficient in in iron. So iron rich food. So I would say please have handful of a fistful of dry nuts every day, which should include anjeer, which should include dates, prunes, and try to include leafy vegetables, green leafy vegetables like spinach, lentils. You can have sprouts, and then vitamin A containing foods. Mango season, nobody can resist mangoes, papayas, and then broccoli. These are very good sources of vitamins, and mushrooms also are very good source. And B12 again. B12 again, you can have lean meat, fish, egg whites, and then you can have cheese, yogurt, but again in definite you balanced quantities so that you don't go overboard. And having milk also helps. Vegetarians especially, I ask them to go with milk. Calcium deficiency, so these can slowly improve the caliber of the hair. It will provide, hair cells are like the fastest multiplying, one of the fastest multiplying cells in the body, so they need lot of energy to multiply. So all these vitamins, minerals put together will drive the hair cells to multiply faster. This would improve the volume of the hair. Length of the hair is again genetically determined. It depends on the length of the hair cycle. For example, scalp hair has a life of 2 years to 7 years. The longer the life cycle, the longer is does the hair grow. But volume is in our hands. So definitely we can improve with diet. And sometimes hair thinning also happens because of the underlying hormonal imbalance. So polycystic ovarian syndrome is one of the major causes for hair thinning. So in women and girls, we have to identify this cause. So apart from hair thinning, they also show up other signs and symptoms like acne, irregular menstrual cycles, unwanted hair in this area. So we suspect, if we come across all these things, we suspect PCOS. Then we usually work up the case and see what is the cause behind, and we treat the underlying hormonal imbalance, and then we also can reverse hair thinning. But all these things have to be done in time. The earlier you diagnose the cause behind your hair thinning, the better are the chances for you to revert your hair back into action. Yeah.
Thank you. So I hope singer Tanuja is here and she got a proper insight about what she has to do. So thank you, ma'am. And let's move on to the next question. Divya is here. How to reduce melanin content in our body through food or any supplements? That's what she's asking.
So melanin is the color which imparts skin color. I mean, it is again, once again, I said when we are born.
Sorry, I think there's some issue with the audio. Ma'am, yeah. Now I can hear. Yes, you're audible.
So
Thank you.
Indians are skin of color. We have, all of us are of different skin color. So the major impact on the melanin is because of the unprotected sun exposure. All of us get exposed to sun. We get exposed to bright light. This can bring about a lot of changes in your skin tone. And all of us want even skin tone to have that good glow and reflection. So there are certain foods which can help, maintain the melanin content. Those are antioxidant rich foods. So all of these include basically yellow orange fruits and vegetables, like your vitamin C rich fruits, your amla, then your berries, and orange. Broccoli is also considered to be a rich source of vitamin C and antioxidant. And your green leafy vegetables, carrots, beetroots, prunes, all these are rich in antioxidants, which will keep the melanin content under control. And most importantly, they protect your skin from the harmful rays of ultraviolet light, which can be a boon. So sometimes, smearing tons and tons of sunscreen also doesn't help. But a person who is good at diet, good at taking diet, 50% of the problem gets solved there. And then 50% rest other protective measures, whatever you take.
Thank you, ma'am. So, next question is, what are the tips to avoid dark circles? Ninath Patnaik is asking.
Yeah. So dark circles again can happen because of many reasons. The foremost thing is improper sleep, tiredness, out of fatigue. So improper sleep is the commonest cause. Second common cause is nutritional deficiency. So among nutritional deficiency, iron and B12 is the major problem. Third one is thyroid hormone imbalance. It could be hyperthyroidism or hypothyroidism. Fourth one is if you already have deep set eyes, like for example, your bone eyes are deep set and the shadow of this bone falls here, and it gives you a false illusion that you have dark circles. Actually, there is no dark circle there. There is only the hollowness here, that we call it as tear. So we need to correct this tear trough. The moment you correct this tear trough with fillers, then automatically things become normal. Yeah, but for pigmentation, it could be superficial or deep. What we call it as epidermal or dermal. Superficial, if it is superficial, then we will put you on supplements and we can put you on skin lightening creams, which are specifically made for the skin around the eyes, because the skin around the eyes is different from the facial skin. And we can also do procedural treatments called chemical peels around the eyes. That will help you. And there are certain lasers which are also performed in advanced stages of and there is one hormone which can cause problem around the eye, that is insulin hormone. So those who are obese, those who are overweight, the insulin hormone goes for a toss. There is a condition called insulin resistance. So once insulin resistance comes into picture, the skin around the eyes becomes thicker, velvety, darker.
Okay.
Also, you must have seen like people who are overweight, they have dark circles which can extend like this. So there you need again exfoliating creams, exfoliating treatments which can help you along with the weight. And lastly, the hollowness that I was talking to you about is called tear trough. This can be treated with hyaluronic acid fillers. We inject hyaluronic acid fillers here that will kind of fill up the shadow and will give you an even contour, and automatically that fatigued look, the tired look, the illusion of the dark circles look fades away.
Okay, thank you so much. That was very insightful, ma'am. So, what's the solution for dandruff and itchy scalp? This is again another question that even I would like to ask you, because due to the extensive use of heating products every day almost, so my hair is also prone to dandruff. So I would like to know what is the solution for this.
Yeah. So basically, our skin has something called sebaceous glands or oil producing glands, natural oil producing glands. They become active the moment we enter puberty under the control of the hormone. Like you have different skin types, like oily skin, dry skin, combination skin. Scalp can have different qualities. Oily scalp, dry scalp, combination scalp. So most often we have a myth that if you wash your hair every day, you will have hair fall. Most of us think like that.
Yes.
So you have, like you say your scalp is getting oily within a day of washing your hair, then there's a call for you to wash your hair, wash your scalp almost every day or alternate day. So if you wash your hair properly, you are not allowing the oil collection there, and dandruff happens because of this dead skin accumulation, excess oil secretion, and there is a resident fungus called malassezia. Sorry, I'm using a medical jargon here. So this fungal infection, dead skin, excess oil, all put together leads to dandruff. Actually, this dandruff itself can lead to hair loss. So to avoid dandruff, you have to wash your hair regularly. Choose the right kind of shampoo, which is sulfate free, which doesn't make your hair too frizzy. Nowadays, you have a host of shampoos available. You don't know what to choose. The best thing is, so the best thing is to use milder shampoos which will not wash away the essential oils. And you should not allow the conditioner to be applied on the scalp. Conditioners have to be applied to the length of the hair. So, and avoid overnight coconut oil application. Probably most of you do not agree with me, but this is the fact. You already have a lot of natural oil, so you don't need excess coconut oil application there, because it will add to the oil collection there and it can aggravate dandruff. So what we usually prescribe, we dermatologists, we put you on antifungal shampoos which contain things like ketoconazole, cycloperoxylamine, which will bring down the fungal numbers in the scalp. So the dandruff comes under control. Later on, you can use once in a while, once in a week for maintenance. These shampoos can be used weekly once for maintenance. If they are like, if the dandruff is recurrent, if the dandruff is very stubborn, then we may prescribe you certain oral medications as well, which will bring down the oil content of the scalp, and automatically the dandruff comes under control. But as you said, I mean, in your profession, you got to use a lot of products, styling products. You have to be a little careful if you're using too much of not good for it. Can break down the bonds in the hair. Now, hair is made up of certain sulfur and hydrogen bonds, so those bonds are broken. Even the chemical treatments that we do can weaken the hair. So you have to use good conditioners, leave on masks sometimes. Again, diet again is very, very important, as we have been discussing right from the starting from of this discussion. Yeah, yeah.
Okay. I just wanted to hear me now because I just got a call. So, so I wanted to know whether the reason behind dandruff is mostly related to oil production, or are there also cases where there is no excess oil produced but still hair has dandruff?
Yes. Sometimes you don't have that greasy dandruff, as you said, excess oil production. Sometimes there is simply flaky scalp, like how your skin becomes dry. Even your scalp can
Yes,
get
yes.
flaky. So there are nourishing creams, nourishing oils. But once again, we do not recommend overnight application of all these
Oh, even
nourishing.
no. In that case, we should not apply overnight oil.
No, no. You should apply it only for short, let's say 2 hours, so that it nicely moisturizes and nourishes the scalp, and then you should wash it off. Yeah, and also
Okay.
if there is any underlying deficiency, like essential fatty acid deficiency, we may give you these omega-3 fatty acids to improve the moisture of the scalp. And we should also look out if there is any borderline thyroid problem, like hypothyroidism or hyperthyroidism. All these
Okay.
things.
Okay, just a second. Okay. So I think most of the questions that we are getting are almost repeated. So let me check if there are any new questions. Otherwise, we can wind up with this session. If you have any questions, please do mention in the comment section. Okay, there's a question: does exercise make hair and skin healthier?
Yes, obviously. So exercise, diet, sleep, lifestyle factors, all these are like 4 pillars for healthy skin. So you cannot remove one pillar here or just manage with the rest of the three. Physical activity is very, very important because it will keep our metabolism going on. So once your metabolism is going good, your digestion, your hormones, everything fall into place. So 30 to 50% of the skin and hair issues can be solved with right appropriate diet and regular exercise and sleep. Definitely exercise plays a major role, especially to deal with the hormones and immune system. So you have to have at least 30 to 40 minutes of physical activity every day, at least for 5 days in a week. Get your 150 minutes of exercise per week. No matter you do 20 minutes a day, 50 minutes or the other day, but make sure you have good physical activity for 150 minutes in 1 week. You can distribute that in 1 week.
Okay, thank you. And what's the solution for pigmentation, and what's the reason for this? Aravind Savalge is asking.
Yeah. So pigmentation is a broad term. It can show up as, it can manifest as pigmentation only on the cheeks that we usually see, that is called melasma. It can occur as tan, especially on the convexities of the face. It can occur something like V-shaped pigmentation here or here, which are called as pigmentary demarcation lines. You can have small sunspots. So all these are either because of excess melanin production, that is color production in the skin, or it could be because of overactivity of color producing cells called melanocytes. So these, then I think there could be many reasons. This could be because of the chronological aging. That means as we age, the dead skin accumulates, skin color gets darker. You must have seen your grandmother's complexion. She must have been very fair when she was young. When you look at her, yeah, earlier pictures, and
Right,
that
right,
we Indians
right.
usually age with color becoming darker. So first and foremost thing is sunscreen application every day, and then moisturizer, and eating all these foods which are rich in antioxidants, vitamin C, A, selenium, etc. And all these will help you to maintain your skin health. And of course, genetics do play a role. If the color you get it from your genetics, like your parents, your grandparents. Third, external factors also play a role. You're exposed to sun without any sun protection. Sunscreen. All of us do use sunscreen, but honestly, how many of us do reapply? Sunscreens are meant to be reapplied every 2 to 3 hours. Nobody does it.
Oh,
You just yes, sunscreens
okay.
have, no matter how tall the claims are, sunscreens, how much ever expensive the sunscreens may be, sunscreens will protect us only for 3 to 4 hours, not more than that. And how many of us apply sunscreen 20 minutes before you step outdoors? That also doesn't happen. Sunscreen needs time to settle down on the skin and give you that protection. So you
Oh,
have to
okay.
minutes before you step outdoors. You can wear your makeup, all other things over it. And then you have to reapply every 3 hours. And then second important thing is quantity of sunscreen usage. This much. Quantity is like not regulated. You have definite quantity which need to be applied. This is called one fingertip unit. If you squeeze the sunscreen, if the whatever quantity between these the first crease and the tip of the finger is called one fingertip unit. So if one needs to apply, you have to apply at least 2.5 fingertip units for the whole face and neck. How many of us apply that? So adequate amount of sunscreen usage, reapplication of sunscreen every 3 hours, application 20 minutes before stepping outdoors. All this is very, very important. All this is very important.
Yeah. That was very insightful. I didn't have any idea about reapplication, and also I didn't know that we need 20 minutes for it to settle down. So that's a very insightful information. Thank you, doctor. And I think most of the questions that you're asking have already been covered. So since I'm going to save this live session, you all can check out the live session and listen to her, talk about the problems that you have. And I think we'll wind up the session for today. So thank you so much, ma'am. We are indeed glad to have you here. Especially for me personally, it was a very insightful experience to interact with you. So also to all the followers here, if you have any skin and hair related issues, you can contact T. N. Rekha Singh ji, who is a renowned dermatologist at AV Skin and Hair Clinic in Telangana. So thank you so much, ma'am, once again. I hope.
Interacting with you, Sirisha. I wish you all the best in all your future endeavors.
Thank you. Thank you so much, ma'am. Okay, thank you.